Thank you so much for tuning in. Today we are going to talk about cervical cancer screening. Okay, so we all know the menace of cancer in the society. You probably know someone, a loved one, a friend, a relative, a family, or maybe even your own that has been affected by cancer, one form of cancer or another, and we know what kind of damage it does, both emotional, psychological, financial. It's a lot. If there is anything that you can do to prevent yourself from getting cancer, I think everyone would go for that, right? Yeah. So cervical cancer is the second commonest cancer among women. The good thing about cervical cancer, there's something good about it, is that it can be prevented. That's the first thing. And secondly, there are methods of early detection, what we call screening methods, that can help you to detect it when it's very early, when you can actually get 100% treatment and cure. Okay, so our focus is going to be on that screening of cervical cancer. How is cervical cancer acquired? Cervical cancer is acquired through an infection called HPV. HPV is a sexually transmitted virus. In full, it's known as human papillomavirus. There are many types of HPV, right? More than 100 actually. And there are generally two categories. There are those that we call high risk and those ones that we call low risk. Low risk means they are not so bad. The worst they can give you maybe is genital warts. Warts are growths that can occur on your body. It could be in your genital area, it could be on your hands, it could be on the sole of your feet, it could really be anywhere in your throat. And there is the type that we call high-risk virus. The high-risk HPV virus, the ones that are associated with leading to cancer, and cervical cancer is just one of the cancers that it can cause. Some of the others include penile cancer, vaginal cancer, cancer of the vulva. It can cause quite a lot of cancers in the body. But I digress. Our focus is on cervical cancer. Okay, so how does one know that they have HPV virus? Unfortunately, you can't know. HPV virus is very common. More than 80% of the population have it. And that means that once you're sexually active, there is a very, very high chance that you might get it. And it's acquired through whichever route of sex you have, whether it's vaginal, whether it's anal or oral. So even if you've not had vaginal sex and you consider yourself a virgin, but you have had oral sex or anal sex, there is a risk that you may have HPV virus or you can acquire HPV virus. Okay, so when or how do I prevent myself from getting cervical cancer? Prevention, the main thing that we have at the moment is actually a vaccine. Okay, so there are vaccines in the market that are targeted against the high-risk HPV virus, and even those ones that cover a bit of the low risk that can lead to genital warts. And therefore, my focus is not on this today, but I will not finish this video without mentioning that please go for HPV vaccination, because really this is one of the ways that you can really protect your children or yourself or your loved ones from getting cervical cancer in future. I see many women who come to me and they ask, oh, should I take my daughter? Should I give a consent for cervical cancer vaccination that is being done at school? And my answer is always, do it like yesterday. Please, if I were in your shoe, I would have already signed that consent, or I would have already taken my daughter to get that vaccine ASAP. So do it. There are lots of myths and a lot of misunderstandings going around it, but please don't believe it. Most of them are just based on fears and people's own beliefs and biases. The truth is it's safe and it's good for your child. Okay, even if you're more than 11, 12 years, 9 to 12 years, even if you're 25, 26, you might actually still stand a chance of benefiting from it. So if you want to go for it, you can still go for it. Sometimes even when you're up to 45 years, you can still actually go get it and still get a chance of benefiting from it. Okay, then we go to screening. So what is screening? Screening is a way of checking everyone in the community and seeing whether they have a disease. Okay, so in this case, about cervical cancer, anyone who is sexually active, because we know that cervical cancer is brought about by HPV, which is sexually transmitted. So anyone who is sexually active and over 25 years, we recommend that you start cervical cancer screening. Why 25? Because a lot of the HPV that is acquired in your younger years, between 15 to 25, your body sort of fights it and clears most of it. And we also know that it takes quite a lot of time between acquisition of the virus and it leading to changes on your cervix that eventually become cancer. So the recommendation is 25. There are places where they actually recommend 21 years. So again, you can follow whichever guidelines your country is following or your institution is following. Okay, there are different types of screening. One of them, the commonest that people know, is something called a pap smear. And I would like to just ask you, have you done a pap smear? If you're watching me and you haven't done a pap smear and you're more than 25 years and you're sexually active, why haven't you done it? I know there are many people who will give reasons such as, oh, it's painful. I've had my friends say it's painful. But the truth is not painful. I know some people get a rough experience with it, but actually it shouldn't be painful. There could be some bit of discomfort, but it should not be painful, and it is not painful, okay? There is no place we are cutting. We just use a brush that I'm going to show you to collect some samples of cell on your cervix, and this is taken to the lab for analysis to see whether there is anything wrong that can be picked. Okay, so some other people are scared about the results, and that's a valid reason. You know, sometimes it's that time that you get a life-changing information about your health, and you know it's valid to be worried. But again, ignorance is not really bliss, especially when it comes to cancer of the cervix, and you could have done something to prevent it or to get even full treatment. You might really regret having not done this early enough. The unfortunate thing is that by the time you get any symptoms of cervical cancer, it's a bit too late to do anything that will save your life. So don't be scared of the results. Sometimes you just have to face your fears head on, right? Okay. Sawa. The other thing that I'd like us to mention is how we go about the process of screening. So there is something here called the speculum. Some of you may be familiar with this, some may not be. So this is a tool that is very dear to gynecologists like myself. We use it basically to do examinations involving the vagina or the cervix. So these days, people have been friendly and they have given us a plastic type of speculum. Before this, it used to be metallic, and even still, we still have places where we have metallic type. So this one is more friendly, at least it's not so cold. Yeah, at least it's not so cold. So what we usually do is put in a lubricant like KY jelly on the speculum, which allows us to put inside the vagina smoothly and open it slightly, just like that, so that we can see the cervix. And then using this brush, quite a friendly brush, very soft, we rub it on your cervix to pick some samples of cells that we will put on a slide, and that slide is taken to the lab for assessment to see whether there is any abnormal cell. The whole process takes about maybe 5 minutes or less, mostly less, yeah. It needs it to be very relaxed, to just relax your muscles so that it's easier. The more relaxed you are, actually the better it is for you and the shorter it takes. But generally there's no place you're cutting, we're just using a brush and a speculum to look and to rub on it, and then that's it. Okay, so that's how a pap smear is done. A pap smear the results will take about maybe 2 weeks plus or minus, depending on where you come from. The results will either come back as negative or they may come back as positive. By positive, it could either be abnormal cells, which are also quite a variety. Okay, so supposing this is the beginning of normal cell, this side is normal, this side is abnormal or cancer. Okay, there is a whole space in between, or a whole difference of cells that your cervix will go through before it comes from normal to cancer or to cancer. So there are those times when you do a pap smear and the changes that you see on the cells are closer to this normal side, okay? What we call low grade or atypical cells. And there are those times that you do the pap smear and the changes are closer to this other side of cancer, what you call high grade. Depending on what we find, we manage you differently, but most of the management are around this time between low grade to high grade or to early cancer through pap smear. When you have no symptoms, it's actually full and 100% cure. Most of the time it may involve either just removing a section, sometimes it's just observation, sometimes it's removing a section of your cervix, or sometimes it's removing your uterus. But most of the time you get 100% cure rate. So don't wait for things to go beyond your control. How often do you do a pap smear? So pap smear, once you've done it, you repeat it every 3 years as long as it's normal. If it's abnormal, your doctor will discuss to you first of all how to handle it, how to manage it, and the follow-up plan after that. Okay, most of the time actually, if it's especially gotten in the low grade or atypical cell region, you may end up things actually getting back to normal, and you continue with your routine screening of every 3 years. Now, there is another type of screening called HPV DNA. So HPV is a virus that I've already mentioned that causes cervical cancer. When you do HPV DNA, it's pretty much the same way that we do a pap smear. So speculum again, that we open to see your cervix because that's where our target is. We use a brush pretty much like the one for the pap smear. So the only difference will come as to where we take this brush. So initially in the pap smear we were putting on a slide that is taken to the lab, but for the HPV DNA we immerse it in a certain bottle that has special fluid that will now be shipped, and they check for the HPV virus. Remember that when they're checking for the HPV virus, they're not checking for the more than 100 types of HPV virus. So they're not checking for every HPV virus in your body. They're just checking for the high-risk ones. The high-risk ones, most of the ones that they focus on are what we call type 16 and type 18, which are responsible for over 70% of causing cervical cancer. So again, they're not going to, when the results are negative, it doesn't mean that you don't have HPV in your body at all, and therefore you should not carry on with routine screening in future. It only means that they haven't seen the high risk ones or the ones that they were looking for. Usually it's type 16 and type 18. Okay, so if the results come back and they're negative for this high risk HPV DNA virus, then the recommendation is to repeat after 5 years. But if they're positive, again, you discuss with your doctor the way forward in terms of your follow-up, because it's a bit different depending on what is found. Sometimes you may combine both the pap smear and the HPV DNA. So on the same setting, you take a brush, put it on the slide for the pap smear, and you take another brush, put it in the bottle for the HPV DNA. If you do both of them at the same time and both are negative, then the recommendation is to repeat after every 5 years. But if one of them is abnormal, then again the follow-up and treatment varies depending on what has been found specifically. I hope you're following up to there. All right. There are other methods of screening, mostly in low-resource areas, and this is also us, especially in our public facilities, right? There is a test called VIA and another one called VILA. It's pretty much the same thing, just different types of staining that are used. So in this particular case, they will do a speculum still, but there's a special camera that we use to look at your cells to see what will happen when you apply a certain stain or a certain solution. So there is an acid we use called acetic acid and another solution called Lugol's iodine that we apply that will stain differently on the cervix depending on whether the cervix cells are normal or they are abnormal, or whether there is some bit of cancer there. So if we put the speculum, apply the solution or the staining, and it's uniform and everything looks okay, then we reassure you that means the result is negative. You repeat after 5 years. But if we see any abnormal staining suggestive of abnormal cells towards cancer, then we take a biopsy. So we may take a bit of a bite on your cervix, just a little. That will be checked in the lab to see what exactly is abnormal about it, and therefore management will depend on how the results will be. Okay. How will the results affect you? So as I said, the results most of the time they're negative. If they're negative, you'll just do routine follow-up. If they are positive, it depends with what kind of positive is there. Is it a low abnormal cell type of thing, or is it a high grade change towards the cancer, or is it actually cancer? The good thing about it, as I said, if you have not had any symptom and this was just picked during a routine screening, chances are, even if it's cancer of the cervix, it's very early and you can get 100% cure by just through surgery sometimes, depending on what kind of surgery has been done. But most of the time you will actually recover fully, and that's our aim when it comes to cancer, right? So embrace it, face your fears, do not be scared, go for this, do the screening. When do you stop screening? The recommendation varies again from country to country, different guidelines are followed, but as we follow up to the age of 65, so until you're 65, you're supposed to do your pap smears every 3 years, or your HPV DNA and pap smear together every 5 years, or your VIVILI every 5 years, okay, up to the age of 65, or up to the time when your uterus comes out. So if your uterus comes out together with the cervix, which most of the time that happens, you can stop, okay? But if it can stop at that time, especially if the reason was for something what you call benign or innocent, like a fibroid, you just stop your screening, of whether it's at 45 or at 40, you stop your screening at that time. But if your cervix was left behind, they remove the uterus alone, the cervix was left behind, you carry on until the age of 65. Or if the reason for removal of your uterus was because of an abnormal pap smear or early stage of cervical cancer, you will need to carry on with the screening again as usual. All right. People who are HIV positive are recommended to actually do the screening every year. The reason is the HIV virus together with the HPV virus, when together, they make things progress much faster, and therefore today your cervix may be normal and your pap smear is fine, but next year, if it's not done, you may easily have acquired HPV and it progresses and gives you cancer. So the recommendation is that you do it annually instead of the routine 3 years or 5 years, depending on which type of test you have done. All right, I will stop there. I don't want to make this video very long, but if you have any comments, if you have any questions, please post them in the comment section. I'll be happy to go through them and answer you. If you have any suggestions, even as to what topic you want us to talk about, please feel free to do that. I will be honored to just take us through that. Have a lovely time. Until next time. Bye-bye.